Greetings, my fellow nurses. Welcome to the Medically Affiliated Nursing Channel. So we're here and we're going to discuss what every nurse goes through when you clock in and get ready for your patient. Situation, background, assessment, and recommendation. As you guys know this, and if you don't, SBAR. Write that down, take a picture, and remember it. It's very important to do this when you come in and clock in. So the first thing you're going to do, once you get your stethoscope, your pen, and you're ready to rock, you talk to the nurse and get situation. What's going on with the patient? Get a set of vitals and get a baseline. Basically, when I say that, temperature, blood pressure, you want to also follow up and get everything else that's part of the vital signs. So you get a baseline on what the patient came in for and if there's any changes in condition. The second thing you want to do is background. You got to look at the patient's history. If they have cardiac issues, pulmonary issues, if they have endocrine issues, if they're diabetic, if they had, let's just say, CABG, coronary artery bypass, surgery. What if they had surgeries? You got to put all those together. What if they're a smoker? If they have COPD? So all those throw in a factor of what the patient's going on, and that's what background is. The third thing that I always look after, and this is the most important one I say, because it's an assessment. You can go off the nurse's assessment, but it's what you're going to assess. So for the assessment, you're going to basically go head to toe. Just work from the way to the top and go to the bottom. So you're going to check for the neuro. The very first thing, you're going to see how their mentation is, alert, oriented, person, place, and time situation. You're going to see how their mentation is, if they're following commands, if their mentation's all there and intact. So you're going to kind of work your way down and listen to the vascularity. You're going to look and listen to the veins. Sometimes you can hear the pulses bounding if they're +1, +2. Sometimes they're +3. Then you work your way down and listen and auscultate to the lungs. There could be chorus, crackles. You can hear some wheezing. Are they, like I said, COPD? If they're coughing, if they're a smoker, like I mentioned earlier. You work your way down and listen to the cardiac sounds. Remember, the heart, that's going to be on the 3rd, 4th intercostal and the midclavicular line. So you got to work your way down and listen to each. Bowel sounds, if they're active, if they're dull. You want to see if they ate anything, if they're hypoactive, what if they haven't had anything to eat. And you also want to keep continuing if they have a Foley catheter, the eyes and nose. It's very important to see how much fluids they had intake and output, right? So if they have a Foley or they may have a rectal tube, we have to talk about it. It's normal when that had a bowel movement, and then you work your way down. And you check the popliteal, you check the arterial, you check all the veins and arteries. You got to see if they have good pulses, guys. And then the last one, recommendations. You're going to be talking to the doctor, you're going to be talking to the pulmonary therapist, you're going to be talking to all the other medical individuals in the field, and you're going to put everything together and make recommendations. How are we going to get the patient better? And this is what's called the care plan. And so like I said, guys, situation, background, assessment, and recommendations. Any questions, don't forget to drop the comments, subscribe, and like. My fellow nurses, have a good one.